In this module, we'll discuss what defines a product as a medical device in the eyes of Anvisa. We'll also go over the importance of proper medical device classification before moving on to the different classifications, and then finally how devices are classified. This page displays an excerpt from Annex 1 of RDC 185 of 2001, which is Brazil's regulations for medical devices. The short version: a medical device is something used to diagnose, prevent, monitor, or alleviate a disease. Now that we know what a medical device is, one of the first steps in the registration process is device classification. Let's take a closer look. Device classification is determined by using the rules outlined in Annex 2 of Brazilian Resolution RDC 185 of 2001. These rules are similar to those used to determine device classification in Europe. Brazil divides medical devices into 4 classifications: Class 1, 2, 3, and 4, and 2 regulatory pathways. Each pathway has its own application format, timeline, and other requirements. There are 2 categories of Class 1 and 2 devices: Cadastro and Registro. The Cadastro pathway is designed for devices that are low risk. These devices follow a simplified application process. The Registro pathway, on the other hand, applies to certain Class 1 and 2 devices which, despite being subject to lower risk classification, have been identified by Anvisa as being riskier than other Class 1 and 2 products. All Class 3 and 4 devices follow the Registro pathway as well. Similar to medical devices in other regions, the higher the risk, the higher the device classification. The higher the classification, the more stringent the regulatory requirements. Medical devices are classified based on the level of risk the device presents to the human body. This is determined by examining 3 criteria: the duration of contact with the body, degree of invasiveness, and local versus systemic effect. Class 1 and 2 Cadastro devices represent the lowest level of risk as they are not complicated to operate and pose little risk to patients and users. Examples of Class 1 and 2 Cadastro devices include a scalpel, eyeglasses, and a stethoscope. Examples of Class 1 and 2 Registro devices include an island dressing, examination gloves, some catheters, infusion pump tubes, topical adhesives, and muscle stimulators. Class 3 devices represent an even higher amount of risk. Examples include defibrillators, laser scalpels, and dialysis machines. Class 4 are the highest risk devices. Examples include pacemakers, heart valves, and stents. This module covered key topics including how Annex 2 is used in determining device classification, how risk is based on the duration of contact with the body and the degree of invasiveness, and how the level of risk is proportionate to the level of regulatory oversight. The next section covers your Brazil registration holder.